Medical travel isn't tourism. It's not booking a flight, a hotel, and a doctor's appointment. It's one of the most high stakes medical journeys a patient can make. I'm Dr. Priyanka Mathur, a physician who has worked across India, Russia, and the United States, and founder of MediPocket USA, a cross-border care company. Over the past several years, I have helped global patients navigate some of the most complex medical cases across 21 plus countries. But here's what most people don't realize. Medical travel can save a life or complicate it depending entirely on how it's done. Today, I'm breaking down the risk, the hidden inefficiencies, what most patients get wrong, and how global care must be coordinated for safe and successful outcomes. When people think of medical travel, they often think of convenience or cost. But behind the scenes, there are serious risks that are rarely talked about. Let me give you the top problem international patients commonly face. 1. Wrong hospital selection. Every US hospital is not a center of excellence. Even within the same city, patients often choose based on marketing, location, or the first hospital that replies. But in the US, medicine is extremely subspecialized. Other is wrong specialists, the biggest hidden risk. For example, not all oncologists treat all cancers. Not all neurologists treat all brain disorders. Not all surgeons handle complex or rare cases. Choosing the wrong specialist leads to misdiagnosis, wrong treatment plan, unnecessary procedures, delayed care, higher cost, and lower survival outcomes. Others missing or incomplete medical records. Hospitals reject 40 to 60% of international patient files due to missing reports or scans. Fourth is visa and travel delays. Without proper hospital acceptance letters, many patients cannot even secure medical visas in time, especially for urgent conditions. Fifth is fragmented care. No coordination, no follow-up, no continuity. Patients are left navigating everything alone while sick. These risks can turn a hopeful journey into a crisis. One thing I want every international patient to understand, US medicine is not generalist. It's ultra specialized, meaning a breast cancer patient should not go to the general oncologist. They need a breast medical oncologist. A brain tumor patient must be seen by a neuro-oncologist, not a general neurologist. A child with a rare disease must see a pediatric subspecialist. A lymphoma case may require hematologic oncologist. These are subspecialists in rare cancers, advanced surgeries, reproductive medicine, neurological disorder, immunology, complex second opinions, gene therapy, clinical trials. This level of specialization is exactly why patients come to United States. Without correct matching, outcomes drop dramatically. With correct matching, patients often get faster diagnosis, correct treatment plans, and better results. Now, let me walk you through the real process behind the scenes of getting accepted to a US hospital. Step 1, medical file review. Hospital requires pathology reports, radiology, MRI, CT, PET in a certain format, lab results, prior treatments, doctor notes, imaging stored in DICOM format. Even if one component is missing, your case gets delayed or denied. Step 2 is specialist determination. Your case is routed internally to the exact subspecialist needed. Step 3 is treatment feasibility and appointment confirmation. The specialist reviews your file and determines if you're eligible, what treatment is recommended, whether in-person or remote consult is needed, expected cost, and timeline. Step 4 is medical visa paperwork. Hospitals provide official acceptance letters essential for US medical visas. Step 5, coordination. This includes scheduling, travel dates, accommodation, translator services, local transport, follow-up planning. Without coordination, everything becomes chaotic. And this is where most patients and families struggle because they simply do not know how complex US hospital protocols are. Now, this brings us to a very important point. Healthcare navigation is a profession. It includes medical training, international experience, hospital partnership, and deep knowledge of subspecialties. A global concierge service like MediPocket USA ensures precision case triage. Patients are matched to the right US specialist, not random one. fast hospital acceptance. We prepare the files exactly a US hospital require, complete, organized, clinically ready. Medical visa coordination, official medical letters, timelines, and supporting documents. Safe travel planning, seamless coordination from airport to hospital, accommodation, follow-up. End-to-end case management. We support patients before, during, and after travel, including remote second opinions, treatment initiations, clinical trial matching, radiation and surgery scheduling, medication continuity, follow-up care from home. For many patients, this is difference between a successful medical journey and a failed one. As a physician who has worked across 3 countries, I've seen how the right medical decision at the right time can change a patient's entire life. And that's why through MediPocket USA, we help patients across 21 plus countries access US centers of excellence with safety, accuracy, and complete end-to-end care coordination. If you or your loved one is considering medical travel, especially for cancer, complex conditions, clinical trials, or advanced treatments, reach out to MediPocket USA. I'm Dr. Priyanka Mathur. Subscribe for more insights on global healthcare, cross-border medicine, and breakthroughs that can save lives.